Hello again for part two of my cardiovascular series. My name is Gina Cavallini with Rosemary and Thyme. So before we get started, I just want to let you know that any of the information that I'm giving you today is simply for educational purposes and should not be used in place of any established recommended protocol that you have currently with your cardiologist or family physician. So if you have any questions about this, please feel free to reach out to me if you want to get started using these protocols that I let you know about, and to talk about any drug interactions that you might be concerned about. And that the information that I'm giving you is also not meant to diagnose anything. So I'm going to talk to you today about iron deficiency anemia and iron-rich foods. And as a treat, I'm going to give you my cardiovascular essential oil protocol that I do here in clinic for my patients who have cardiovascular issues. So iron deficiency anemia is caused by many things. So one is just simply a diet that is low in iron already. So we get our iron from food, but only 1 milligram of that iron is actually absorbed out of the 10 to 20 that we ingest in our food. So a person unable to have a balanced iron-rich diet is going to suffer to some degree of iron deficiency anemia. You also want to consider if you've had any changes in your body. So an increased iron requirement and increased red blood cell production is required when the body's going through changes. So think about when you're pregnant, if your children are experiencing growth spurts, and also if you're lactating. If you have had any gastrointestinal abnormalities or surgery, you also are at risk of not being able to absorb additional iron. So think about that if you have had any of the gastro surgeries, because what happens is that the abnormalities in the GI tract could alter the iron absorption, because a lot of our iron is absorbed in the upper small intestine. And then blood loss. Loss of blood can cause a decrease of iron and result in iron deficiency anemia. So you could have GI bleeding that you're not even aware of when women have their periods every month, or if you experience an injury, or even giving birth, that could cause a decrease in your iron. So in Chinese medicine, we love to look at the tongue, and this is some common tongue symptoms that people have when they have iron deficiencies. So they have a paleness or a lack of color on their skin. So this guy is very, very pale here. They might be very irritable. They are very tired and easily fatigued, and they have an increase in their heart rate. And they'll have a sore and swollen tongue. So you can see that his tongue is really pressing out on the sides and filling up the mouth. You might experience enlargement of your spleen. And you also might have a desire to eat interesting substances like dirt or ice cubes. And so think about the things that you're craving. Especially if they're out of the ordinary. So here are some iron-rich foods that you can easily pick up at your local grocery store and begin eating if you want to increase your iron. So eat your egg yolks, dark leafy greens, obviously red meat if you are not a vegan. If you are vegan, lots of whole grains and dried fruits, and legumes and nettles and quinoa. So mix all these things together and you have a plethora of vitamins you are getting, and also taking additional vitamin C maybe as a supplement, and eating lots of vitamin C rich foods, because that helps the body absorb the iron more efficiently. So do you even need iron supplements? Like, some people know that there's actually Getting too much iron can actually be a bad thing. So diets can supply approximately 15 milligrams of elemental iron. However, the absorption of iron, like we talked about, is very poor. And only approximately 10% of this even gets absorbed that we take in. So our recommended daily allowance of iron as an adult is 15 milligrams. 1.5 milligrams of that is actually going to be absorbed. So if you are pregnant, your recommended daily allowance goes up to 30 milligrams, in which 3 milligrams is going to be absorbed. And when you're lactating, you can return that recommended daily allowance back to the 15 milligrams. So if you are staying within that range, whether you are getting it with a supplement or through all of your iron-rich foods that I showed you that you're eating all of the time, then you should be okay. Like, remember, if you are starting to feel abnormally fatigued all of the time, pale skin, and those symptoms that I talked about, then check your iron levels, and you can do that with your PCP. So with normal menstruation, 12 to 15 milligrams of elemental iron can be lost. So you might want to take a supplement when you are during your menses. And in pregnancy, 500 milligrams of additional iron is needed to expand the red cell mass, and another 500 is needed to supply the fetal and placental tissues. So that 15 milligrams is pretty safe if you are not experiencing all of these symptoms that I talked about, and then definitely talk to your doctor if you are pregnant about an iron supplement to make sure that you are getting the correct amounts for both you and for baby. So in my part one, I talked about these vitamins, but I want to again stress a multivitamin that includes iron. And I love my Microplex because not only does it give me all the other vitamins that I need, but it has 6 milligrams of additional iron. And the rest I try to get through all of those iron-rich foods that I talked about. I'm a meat eater, and I eat shellfish and poultry and all these things, so that's how I'm getting that. But I also love my broccoli and my vegetables. Think about leafy greens as well to supplement in from the cabbage family. So I talked about broccoli, but don't forget kale and turnips and collards, very high in iron. And then legumes that are high in iron are lima beans and green peas. And I love green peas. Dry beans and peas, you can have pinto beans, black-eyed peas, and canned baked beans are also iron-rich foods that you can get right off the shelf at your grocers. Cacao powder does contain iron, so if you are not eating sugar, but you want a little treat, eat some cacao. And coconut milk also contains iron. And let me know if you need additional supplementation. I can help you out with that. So how much is too much? Next time you go to your doctor, get your ferritin levels checked at your next lab draw and see where you're at. I'd highly recommend to take a screenshot of this so that you can gauge everyone in the family to see where they are supposed to be. So if you are taking too much iron, you will have some symptoms. So you will experience diarrhea, so pay attention for that. You might have black stools and stools that have blood in them. That can indicate that you are actually taking too much iron supplement, and you might feel nauseous, vomit blood, or even have a metallic taste in your mouth. So just keep an eye out for those things. Take a screenshot of this, and this will let you know where you should be at. All right, so if you're on my Facebook page, sometimes we get together and do these oil protocols together live, but take a screenshot of this. If you have essential oils at home that are pharmaceutical grade, like I do, if you don't, please talk to me. I can help you out with that. Then you can apply this following list of oils, and I will, you apply them in order. So screenshot this. This is my cardiovascular protocol that I use here in clinic with people when I do my aroma touch sessions and things like that. And these little symbols tell you where to put that on. So frankincense, you're going to inhale it in through the nose and apply it to the bottom of the feet and put it, all around the back of the neck. Apply your carrier oil to the spine. So a fractionated coconut oil, jojoba oil, anything like that. And then you're going to do in order. So thyme, massage blend, which is aroma touch, turmeric, then lemongrass, protective blend, which doTERRA calls On Guard, but other brands might call it, I think, thieves oil might be another name that they call it. That's the protective blend. Marjoram, basil, and then lavender and peppermint. And you do that to the spine and the bottoms of the feet. And you don't have to have people do this for you. You can literally apply it to yourself. Just line out your oils, keep them next to your bed. When you wake up in the rising, take a nice big cup of water, a pint glass of water, get yourself hydrated, and then simply apply these oils just in a row. So here's all the conditions that we use this protocol to treat. So if you or a family member has any of those, then there is your treatment. And then if you have questions or you just kind of want to know where you stand, please talk to me. Every Wednesday night, Dr. Mika and I get on Zoom together for people who want a free tongue analysis. And we will look at your tongue and gauge what's going on. And then I will give you a protocol that you can use, supplements and essential oils based on your tongue and based on where you're at and your lifestyle and what works for you. And you can connect with me at my Facebook group, Rosemary and Thyme Oil Mavens. So thank you so much for joining me for part 2 of my cardiovascular series. I get so tongue-tied. And stay tuned for more.